Welcome, Dr. Pete.
Hi, Phil. It's good to be here.
Allow me to introduce you. Dr. Pete LAllier, the founder of Hopkins Health and Wellness Center, is in his 20th year of chiropractic practice. Dr. Pete led the team of physical therapists and chiropractors that developed a non-surgical method for treating disc herniations and challenging neck and back conditions. What does DMR stand for?
Decompress, Mobilize, and Rehabilitate. The DMR method is a system of treatment that we've developed at Hopkins Health and Wellness Center to predictably treat disc herniations that many times people would think would need surgery to correct.
How was the DMR method developed?
You know, I've worked with a team of physical therapists as a chiropractor for approximately 18 years. In that time, we've seen, the whole spectrum of different types of back and neck conditions, including disc herniations. And we started to see a pattern of being able to recover disc herniations without using surgery if we had a combined approach where we had chiropractors doing a portion of the care and physical therapists doing a portion of the care. We had one case in particular where we saw a patient that had a severe disc herniation. We treated them for 8 weeks, and then we sent them back in for an MRI scan to see how the disc had responded, and we found out that the disc herniation had completely resorbed with what we had done. Based upon that, we started talking to the radiologist who read the MRI scan, and he's from the Center for Diagnostic Imaging, and he in turn said, let's do a study on this, and let's see if we can keep doing this with more of the patients. So over the next 2 years, we put together a very regimented process that we followed with physical therapy and chiropractic. We did pre and post MRI scans, and we found that the vast majority of the time we were able to fix the disc herniation problem without surgery. After we've done an initial evaluation, we found out that we think the person is a candidate for the procedure. The next thing that they do is they have a consultation with our physical therapist. The physical therapist sits down with them and they do a very standard evaluation to identify where they're having pain, what their pain level is, how it's affecting them functionally and their ability to do their normal daily activities. And then we use a combination of oscillating decompression traction, cold laser therapy, stretching, exercises, and other rehabilitative procedures, including proper body mechanics, lifting, bending instructions, other spinal hygiene exercises and stretches that we do. Study that we did, we found out that the 3 keys for recovery with the person is if we can restore mobility to the disc first through doing oscillating decompression therapy, manipulation, and stretching, and then once we've done that, improve alignment by doing physical therapy and chiropractic, and then get it strong and stable that way. Those 3 things in that specific order is what produces the best outcome.
There seems to be a strong emphasis on self-care in the DMR method protocol. How important is self-care?
It's invaluable. In fact, before we start the program with anybody, we talk to them about making a commitment towards following through on the self-care program. And that's not just doing the exercises and stretches that they're instructed in doing with the physical therapy program. It's also lifestyle things, how to lift the right way, how to bend the right way, how to sit the right way when they're at work or at home. A lot of lifestyle things that they get taught as part of the DMR program. They have to be willing to follow through on that, both in the short term in the recovery process so they're not re-aggravating the tissue that we're trying to get to heal, but also in the long-term recovery and re-strengthening their spine. They have to do their part in following through on the self-care.
How long is the DMR method protocol?
The protocol of treatment is 10 weeks. It's 8 weeks of intensive treatment where we see a person 3 times a week for 4 weeks and then 2 times a week for 4 weeks. And then there's a couple other weeks of treatment where we do some follow-up to make sure the person's staying consistent with their program, their home care, their exercises, and to make sure that there's nothing missing in the recovery.
What was the success rate of the 2-year study in the DMR method?
For cervical and lumbar disc herniations, 96.4% saw a significant improvement in the decrease in the amount of pain that they were having, and a significant improvement in their ability to function and do the activities of daily living, the things that they do on a daily basis.
That is really remarkable, especially for people who thought that surgery might be the only option.
Phil, it really is amazing because in clinical healthcare research, a 15% improvement in a person's functional capacity is deemed to show that a procedure is effective, and the average improvement in functional abilities for a person that did the DMR method of treatment was greater than 50%.
Now, I understand that you'll be launching phase 2 of the DMR method. What are you looking to achieve there?
We learned from the first study that we could effectively treat most disc herniations without surgery. Well, in that process of doing that study, the physical therapists and the chiropractors identified some things that they wanted to change, that they thought they could help further improve the treatment protocol. In a lot of cases, it was make the person progress faster through the recovery process. But also, our research partners at the Center for Diagnostic Imaging brought to us a brand new technology, a brand new MRI technology that's called the Fat Infiltration Index. And that's a measurement that they can do on an MRI scan. They can tell how conditioned and how strong the muscles are that support the spine. That's significant to us because when people come in here, a lot of times they're deconditioned, their spinal muscle, the muscles that support their spine are weakened, and we put them through a process of remobilizing, realigning, and re-strengthening their spine. And for the first time, we've got an objective tool that we can measure after they've been through the DMR protocol to see how much stronger we've actually made the core muscles around their spine.
Dr. Pete, why would a patient choose the DMR method as opposed to a surgical method of intervention?
That's a great question, Phil. First off, there's some partners that we've had for years that are orthopedists and neurosurgeons, that their goal when they evaluate a person with a disc herniation is to do everything possible to prevent having to do surgery. The least reliable procedure you can do to the spine is surgery. It has the highest failure rate of all procedures that you do to the spine. The DMR method has a 96.4% success rate, less invasive, better outcome, and it's a much safer procedure to do than surgical intervention. Absolutely, sometimes surgery is necessary for disc herniations, but what our belief is, and the neurosurgeons and orthopedists that we work with, is exhaust all conservative measures first before proceeding with surgical intervention.
Surgery is by far the most difficult on the patient as far as recovery time as well.
Yes, a minimum of 3 to 6 months following surgical intervention.
And with the DMR method, there really is no recovery time. Is that correct?
No, usually within the first 2 to 4 weeks, a person notices kind of a light switch response where they say, wow, my back is feeling better, I don't have the symptoms into my leg or my arm anymore, and from there it's just a slow, steady recovery and getting the person balanced and strong again.
I know everybody will be interested in how much the DMR method costs and if insurance covers the treatment. Can you speak to that?
Yeah, first off is that all components of the DMR method of treatment are qualified for insurance reimbursement. And we do our initial consultations with patients for the DMR method. We always verify the insurance before the person incurs any costs. They know specifically what their insurance coverage is, what is going to be their financial responsibility. We also have a policy of not charging for our initial consultations for the DMR method because we're interested in finding the people that we can help. And the people that we can't, we want to make sure we refer them to the right healthcare resource to get the solution that they need for their condition.
Well, thank you for the work you're doing, Dr. Pete. I know that people with back pain are watching this with great interest and great hope.
Great. Thank you very much. We hope we can help a lot of people with this.